Six pillars of health and wellness. That's what we've been covering here toward the end of 2020. We have already done shows on nutrition, and a show on exercise, and a show on reducing chronic stress, a show on sleep, a show on supplements. That was 1, 2, 3, 4, and 5. And here's our spine and nervous system and immune system. I'm going to talk about those connections. I am a chiropractor, so these are the things that I've been doing. I've been doing chiropractic for 31 years now, and I've got a good pile of stuff for you today. As I get into the spine, brain, and nervous system, I just finished a webinar with one of my gurus, Dr. Dan Murphy. Dr. Dan Murphy is a chiropractor in California. He is 65 years old. He is one of the sharpest people on the planet that I know. He just showed us an article from the Journal of Photochemistry and Photobiology. Now, here we are in the middle of COVID-19. Here's the title of this article: Light as a Potential Treatment for Pandemic Coronavirus Infections, a Perspective. Now, I have a low-level laser in my office. I've talked about it for years. I've had it for 15 years, and I've used it on hundreds, if not thousands, of patients now. And this is talking about low-level laser as antimicrobial, which is pretty cool. Now, some of you are already familiar with UV light. That's different than therapeutic low-level laser. UV light, you can't use it on humans because it's damaging to DNA. But you'll see that, like, if people are using protective hazmat suits and protection and so forth, and using it on airplanes, and probably a good idea. I'd rather have that used than harsh chemicals. But this is for use on humans. This paper cites several studies showing that phototherapy laser has immense potential for reducing the impact of coronavirus diseases. Wow. Okay. Phototherapy was one of the most effective treatments used to reduce the impact of the 1918 Spanish influenza pandemic 102 years ago. The evidence shows that violet blue 400 and 470 nanometers light is antimicrobial against numerous bacteria. Evidence shows that blue light inactivates several viruses, including the common flu coronavirus. COVID-19 is a coronavirus. Red is the one that I have, and near-infrared light reduces respiratory disorders similar to those complications associated with coronavirus infections. In patients, red light has been shown to alleviate chronic obstructive lung disease and bronchial asthma. Violet and blue light has the potential to reduce infections, sanitize equipment, hospital facilities, emergency care vehicles, homes, and the general environment. We better look into that. As we move into the chiropractic thing, just want to let you know, military is going to be expanding the use of chiropractic because they did their own studies on the usage of chiropractic in VA hospitals and so forth, and they found this is good stuff. So U.S. Brigadier General Becky Halstead, who is retired, has been a thrust in this movement. Stars that use chiropractic, some people that you certainly know: Cindy Crawford, Tony Robbins, Mel Gibson, Leonardo DiCaprio, William Shatner, Sylvester Stallone, Phyllis Diller, Kim Basinger, Demi Moore, Jerry Seinfeld, Anthony Field, Robert De Niro, Ted Danson, Denzel Washington. Pros that use chiropractic. Virtually every professional sports team in every sport now has at least one chiropractor associated with the team. Then you've got Jordan Spieth, Sidney Crosby, Tom Brady, Joe Montana, Emmett Smith, Wade Boggs, the Red Sox, all the professional athletes, Wayne Gretzky, Aaron Rodgers, Boston Breakers pro soccer team, Arnold Schwarzenegger, of course, Venus Williams, Olympians, Peekaboo Street, Nancy Lieberman, Dan O'Brien, Dwight Stone, and it goes on, Merrill Moses. So there's a lot of other notable people that are utilizing chiropractic because they understand the benefits for peak performance in their lives. This was an article I wanted to touch on because it was so old and so pertinent. Time magazine, June 6th of 1983, cover story. Now remember, one of the 6 pillars that I did was stress, right? Called Stress, the Epidemic of the 80s. Apparently the epidemic never stopped, right? Interesting. Chiropractic. Now, I'm going to be talking about chiropractic and brain and immune system and pain, chronic pain. Half of the adults in the United States have chronic pain. The number one spot by far, of chronic pain is the lower back. That can lead to a tremendous amount of problems, including stress, which is going to decrease your immune response, which is going to make you more susceptible potentially to infections. That could potentially be coronavirus. Interesting. Cutting down on pain is a good idea, right? Today, at least half of all U.S. opioid overdose deaths involve a prescription opioid. Chiropractic has the triple aim of better clinical outcomes than opioids, greater patient satisfaction, and lower cost of care. And these articles are just increasing in number. One thing that I've talked about as well as we talk about chronic spinal pain, omega-3 fatty acids, fish oil, as anti-inflammatory and alternative to non-steroidal anti-inflammatory drugs for discogenic pain. We're talking people with chronic low back pain. Almost everyone with chronic low back pain has low back pain because they have a disc problem, discogenic pain. The discs are the cartilage pads in between the bones. Surgical Neurology is the journal, April of 2006. I've talked about this. Dr. Joseph Maroon, neurosurgeon. He was a neurosurgeon in the past for the Pittsburgh Steelers. Conclusions. Our results mirror other controlled studies that compare ibuprofen and omega-3 essential fatty acids, demonstrating equivalent effects in reducing arthritic pain. They were able to knock out most of the chronic pain, something like 80-something% of it, by just giving people omega-3 fish oil. One last thing as I roll into the spine stuff, because I wanted to pull this up again. This is Dr. Anthony Fauci, now a household name, as we talked about before the show rolled here. This is an article off of Business Insider, September 17th of 2020. Fauci says the 3 best things, quote, to keep your immune system working optimally cost nothing. His 3 things are: get a reasonable amount of sleep. We did a class on the 6 pillars of health, sleep. Eat a good diet. He's talking about that as strengthening your immune system. That's free. Try to avoid or alleviate severe stress. We did a show on stress. He hit 3 of the 6 things that we talked about right there: sleep, nutrition, stress. We could add in there exercise. We can add in their spine and nervous system. We can add in their supplements. By the way, this same article talked about that he takes vitamin C. He takes vitamin D. Dr. Anthony Fauci takes 6,000 international units of vitamin D per day. He said in here, I tested low on my vitamin D. I took vitamin D. Now my level is normal. And in the same article, he said, my vitamin D is normal. We know from many scientific studies, follow me now, COVID-19, here we are in 2020, many scientific studies that being deficient in vitamin D can put you at greater risk of infection, and that finding has held true again during the coronavirus pandemic. Dr. Anthony Fauci is suggesting take vitamin D. I take 6,000 international units of vitamin D, Dr. Fauci said. Interesting, because he said all of these studies say, good idea for your immune system. Here we are rolling forward. Kids' motivation. When you might have a challenge or two motivating your kids to eat a little bit better, get some exercise, get off the social media and get to bed, take some supplements, go to the chiropractor, do those things, right? I always pull this card. I pull the TB12 card. Now, not all of you are fans of Tom Brady. I totally get that, but let's just use this as an example. Let's say that Tom Brady is pretty good at what he does. He's had a fairly long career, and let's say right now that he's doing pretty well in the physical and mental health department, right? Probably most people would agree with that, right? What is his lifestyle like? Most of you know that he's got a super clean diet, he's got a great regimen, he's got an amazing exercise regimen, he's definitely getting enough sleep. He really is a super chiropractor supporter, so it's part of his regimen as well. So I pull the TB12 card. Make sure you do that with your kids if you need to do a little bit of motivation. I always like to mention Dr. Jack LaLanne, Dr. Jack LaLanne actually, yes, because Jack LaLanne is a chiropractor, was a chiropractor. Jack LaLanne lived until he was 96 years old. He passed away in 2011. Now just keep in mind that he lifted weights and swam every day until the week that he passed away. He caught pneumonia and died in a week, so basically he died of old age at age 96. No pharmaceutical medications, no over-the-counter medications, no chronic disease. Most people will say led an active life, again, lifting weights and swimming until the week that he died. He also had an impeccable diet. He had a super clean diet. Most of you know that. But remember that he was a chiropractor. Jack LaLanne was a chiropractor. Now, he never practiced chiropractic that I know of because his fitness career took off, but he understood the importance of spine, nervous system. He always went for chiropractic care, and that was one of the things that kept him healthy in his eyes as he moved along. So clean diet, regular exercise, super great attitude, right? Super great attitude, reducing his chronic stress, chiropractic care, taking care of spine and nervous system, and so forth, right? And he was the juice man and so forth. Needless suffering here. So our CDC, our Centers for Disease Control, has said 75% of what we spend our healthcare dollars on are for things that we can prevent. Most doctors, including myself, state that 95% of heart disease and cancer is not genetic, which means you don't have a spontaneous genetic defect that pops up that gets you sick and gives you heart disease and gives you cancer. Most doctors, including myself, are not saying that. Most doctors and myself are saying 95% of those results are from lifestyle and all of these pillars here that we're talking about. So needless suffering is why I'm saying that. Next here, I just want to talk about Brian, and Brian has a testimonial on my website, and he was brought to me, if I remember correctly, he was 8 years old. He had chronic migraine headaches. Now, it's not normal for an 8-year-old to have chronic migraine headaches, so he had a brain scan just to make sure he didn't have any big bad problem in his head, and he did not, but they didn't know what else to do with him. Okay, so luckily somebody from the friend of the family knew me. They said, try the chiropractor, bring him in. When I did the exam, now he had no neck pain, no neck pain. Poked my fingers here, big tender knot here. Ow, that really hurts, and it makes my headache worse. We started adjusting him, and several months later, his headaches are gone, and that was, gosh, I think 12 years ago now at least. So that's talking about circuits in the brain. Now keep in mind that migraines, and it's not a cervicogenic headache, it's a response of the sympathetic parasympathetic controls, gas and brake nervous system of blood vessels in your brain. So I, as a chiropractor, I am stimulating nerve endings that is going to bring more sympathetic parasympathetic balance back into the system, basically quieting down the sympathetics and letting the parasympathetics rise to get better blood flow regulation to the brain, which is going to help alleviate, in his case, took care of his migraine situation. So that's an indication that if we have better sympathetic parasympathetic balance, we're going to have better blood flow to every cell in our body, every organ, every immune organ, every system. So there's a potential connection with improving health of everything in your body. Bernadette, a great testimonial on my website, 64-degree scoliosis. Now, when we look at the spine straight on, by the way, this is not scoliosis, this is bad posture. Scoliosis refers to looking at the spine straight on. When we look at the spine straight on, ideally, it would be straight up and down. And if it deviated 1, 2, 3, 5 degrees, we don't even use the word scoliosis until you're at least 10 degrees out of alignment. She was 64 degrees out of alignment, already in her 40s, in chronic pain. She comes to see me. She knew she had the scoliosis because diagnosed when she was younger, no surgery. So we worked on her for 6 months, 3 times a week, 6 months. Got her pain-free. And she found if I do my exercises every day and I come and see you every 3 weeks, I'm good. If I don't do my exercises regularly, if I miss my appointment, pains and aches start to trickle back. So now, did I move that 64-degree scoliosis? Nope. If you take x-rays, she probably still looked like this. As the twig is bent, so grows the tree. She was an oak tree. We weren't going to change the alignment of the oak tree, but what we did is we managed it really well, so she was really thrilled about that. Remember that chiropractic healthcare. Chiropractic started on September 18th of 1895, and the first chiropractic patient did not have back or neck pain. The first chiropractic patient had deafness in one ear. So the chiropractor, Dr. D.D. Palmer, adjusted an upper thoracic bone here in Harvey Lillard, the first chiropractic patient. Hearing improved, okay? Now, is there a hearing nerve? Is there an ear nerve down here in the thoracic spine? Nope. That's why chiropractors are quacks, okay? We started working on the spine for early on in chiropractic. We were working on chiropractic people that had visceral problems and mental disorders and infectious diseases. Now, chiropractors were working on the spine only and seeing good results in lots of people, but we couldn't really explain how that was in the early stages, again, 1895 and the first several decades, until neurology caught up, and later on we understood, okay, so we didn't unpinch an ear nerve down here, but we certainly, through thalamic influences and thalamic integration, allowed the hearing messages from the intact ear to get through the brain for representation onto the brain, and that's what happened, and that's why I'm able to explain to you how that happened, but we couldn't do that early on. So that's why chiropractors were thrown in jail and so on and so forth early on, but there's a lot more respect for it now than there was. Now, of course, 102 years ago, in the 1918 flu pandemic, people under chiropractic care and osteopathic care at the time had much greater successes than people under traditional medical care at the time. Again, we couldn't explain the connections exactly between the spine and mechanoreceptors and function of the immune system until now. But here was parts of information out of a chiropractic textbook and from the Journal of the American Osteopathic Association. I was about to go out of business, said a chiropractor, when the flu epidemic came of 1918, 1920, but was over and I was firmly established in practice. Why? The answer is simple. Chiropractors got fantastic results from influenza patients while those under medical care died like flies all around. And then there's some statistics. I don't have time to get into them all, but here's one thing, and this is well documented. In New York City, under influenza numbers, medical methods, out of 10,000 influenza cases, there were 950 deaths. Under drugless methods, including chiropractic and osteopathy, of 10,000 cases, there were 25 deaths. Chiropractors in Oklahoma treated 3,400 cases of influenza with only 7 deaths. There's a clear record showing that chiropractors were called in 233 cases where medicine had cared for the patients and finally given up as lost. The chiropractors saved all cases of the 233 except for 25. Again, there's some suggestion between spinal work and the function of the immune system. Suggestions of that, suggestions. So here's some other, that's right, here's some other articles here. This is a great article here from Forensic Science International in 2002. So here's a journal, Forensic Science International. Kind of odd that there would be a chiropractic article in there, but this is for sudden infant death syndrome. I'll just read you the title here. Heart rate changes in response to mild mechanical irritation of the high cervical spinal cord region in infants. Wow, what a title. And what this article basically says is, as they examined infants and they saw mechanical disturbances in the neck and they saw heart rate problems, then they received chiropractic care, there was great improvements that were detected. They noted asymmetries in the horizontal and sagittal planes of body posture and motion. Asymmetry was determined by x-rays. So here's infants from 1 to 12 months and they saw that there were potential problems here. So they did x-ray evaluations and saw these misalignments. Chiropractic therapy was proven to be a successful technique which can be used to treat disorders, especially cerebral disturbances of motor patterns of various etiologies. Wryneck, C-scoliosis, irritation of the plexus, brachial plexus. Sensorimotoric disturbances of integration ability, as well as pain-related entities such as cryberries, colic, hyperactivity, and sleeplessness. That's just by making adjustments here in the upper neck, and I've been doing that myself for 31 years, and I've seen some great stuff about that. And by the way, in this study, there were 20,000 chiropractic treatments without any serious complications. So that's a pretty good number on there, and that's a study that I like to talk about all the time. That was 18 years ago. Here's one out from the column Dear Abby, from 1992, Solutions for Bedwetting. Dear Abby, I took my 15-year-old twin son's daily bedwetters to a chiropractor, and within a month, both of them were completely cured of their bedwetting. Reply by Dear Abby. I believe you. I have several hundred letters bearing the same message concerning chiropractors. Now listen, this is Dear Abby following up her comment. I'm well aware that some in the medical profession will criticize me for giving what sounds like a commercial for chiropractors, the stepchildren of the medical profession, but I would be less than honest if I did not publish your letter. And just a little bit about that, just for a moment as a side note. I think we're all on the same team. Nurses and doctors and nutritionists and physical therapists and chiropractors and so forth, we're all on the same team. We're all humans helping humans. And even since I've been in practice 31 years now, I have seen a great expansive, improved relationship between, let's say, medicine and chiropractors and so forth, where it was a little strained earlier on in my career, but I now have doctors that have come to me for care. I have doctors that are bringing their family members in for care. I had a doctor that referred in his 95-year-old father. The doctor called me and said, hey, can you look at my dad, who's 95 years old? I said, sure. Dad had a back problem. He was putting on a pressure stocking. He wrenched his back. Doc called me and said, would you look at him? Sure thing. I worked on him for a month. His back was fine. That's how it works now. The relationship is so much better. We're just trying to help people, and that's the idea. As we move along talking about the spine and the brain and the immune system, there's an article out of JCCP is the journal, October of 1997, the role of chiropractic adjustments in the care and treatment of 332 children with ear infections, otitis media. And number of adjustments, chiropractic adjustments to normalize the ears was, for acute ear infections, 4 adjustments, for chronic, 5 adjustments, not bad. And I've seen the same with myself. You'll see that in just a moment. Number of days to normalize the otoscope examination for acute ear infections, 7. For chronic ear infections, 8.5. 6 months recurrence. Now, after these kids were worked on and treated and so forth, how many of them got ear infections down the road? The kids with acute had 11% recurrence rate, and the chronic, only 16% had a recurrence of ear infections. Now, that's pretty cool. So here's a couple of examples I wanted to give you. I have a patient, Darlene, that's not her real name. She was brought to me at a year old. She had 20 ear infections, and this is at least 20 years ago. She had 20 ear infections, multiple rounds of antibiotics, and the doctor said, we might have to do tubes here, and the parent said, is there anything else? And the pediatrician said, I know this chiropractor nearby that works on, lots of chiropractors, it's not just me, but lots of chiropractors work on children and babies, and knows about this chiropractor nearby that works on kids with chronic ear infections. So I don't know how it works, said the pediatrician, but you could try that. So they decided to try it, and she only came in 6 times. And the ear infections were gone, not to return, and that's 20 years ago. If they ever see this show, I hope they contact me and let me know how things are going. Then Haley came into me. She had 15 ear infections in our first year of life. And I worked for her for a while, and she only had 1 more ear infection after that, and she blames that on me because I was out of town at a conference, and she got an ear infection, so she blamed that on me. Caitlin is another case I wanted to talk about. She was brought to me. She was several years old. She had terrible, terrible respiratory problems and asthma. We started the chiropractic care. When she started, her lung capacity was, if I remember correctly, 250 milliliters per breath. In just like a month of care, it went up to 325 milliliters, and her breathing got better, and they were measuring that, and the other doctors were monitoring her, and after the addition of chiropractic care, she did much better. We also got her off dairy products, would help her with the skin problems and so on and so forth. So she did really, really well. And again, what these studies are saying that in these cases that I'm telling you is the connection between spinal work and improving the information into the nervous system with mechanoreception, into the spinal cord, sympathetic, parasympathetic regulation, improvements in brain input, improvements in brain output, and the regulation of all those systems, of course, right? Chiropractic in children, there's a bunch of studies here. A safety study, 781 patients, 5,200 chiropractic adjustments over the course of 2 years with no serious side effects. That's pretty cool. Nursing dysfunction, children having trouble nursing and latching. 114 infants, 78% were able to exclusively breastfeed only after 2 to 5 chiropractic visits. Colic, great improvements. Long-term colic, really difficult cases. 117 went with chiropractic care, 111 without. The kids under the chiropractic care were twice as likely to do better. Chiropractic and Reflux was some other studies here as well. That brings me up to the 5-month-old that I love to talk about, the 5-month-old boy that was brought to me. This was 4 years ago now. He had explosive reflux. He would eat and out would come, eat and out would come, right? Mom was just beside herself, didn't know what to do, went for doctor's visits, went to a pediatric gastroenterologist. The 5-month-old was put on Prilosec. Still not getting any better. She was going to a chiropractor, not me. Asked her chiropractor, do you think chiropractic could help my 5-month-old boy? The chiropractor said, maybe. I don't work on kids, but Fuller does. So she brought him in. I worked on his spine only with an instrument. No manual stuff, just an instrument. Tap, 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 up and down the spine, up and down the spine. He actually really enjoyed it as well. 6 visits, reflux was gone, not to come back. He's doing awesome. Again, improved input through those specialized nerve endings on the tissues in and around the spine, improve the input, improve the output, gut function improved, better regulation of sympathetic, parasympathetic nervous systems. Sounds like something that we should all consider and look into. Talking a little bit about pain. Chiropractic decreasing pain. This was a study out of the Lancet in 1990, so we're talking 30 years ago. There was a strong, clear advantage for chiropractic patients. Sustained improvements with chiropractic care over the course of 3 years. The improvement was best in the study for the people with chronic low back pain in chiropractic. Then that great study that I talked about, which was chiropractic versus Celebrex and Vioxx, out of the Spine journal called Spine in 2003. Only 9 weeks of care now. After 9 weeks in the drug group, 5% people got better. In the acupuncture group, acupuncture was in here, 9% improvement. Chiropractic group, 27% improvement. Chronic low back pain in 9 weeks. Also in the chiropractic group, 47% said we have improvements in our general health status, and they followed up with these group of people a year later with 7 outcome measures. 5 of the 7 outcome measures a year later were still better in the chiropractic group, much better than the drug group. So that was pretty neat. Then we had the long-term follow-up that was a year later. Then we had for acute low back pain where chiropractic was compared to diclofenac, a common non-steroidal anti-inflammatory medication. And conclusion, the chiropractic adjustment significantly better than the drug and placebo in that study, so good for acute low back pain as well. This study out of Spine magazine again in 2011 said not only is chiropractic adjusting effective for treatment of low back pain, but it is best for long-term benefit by continuing with the care after pain is improved. Then, these are the couple of cool studies here. We've got 2 great studies on chiropractic and high blood pressure. So now again, as we're talking about spine and brain and immune system, here's again, when we improve the spine, we're going to improve the sympathetic and parasympathetic balances into the system. Remember that this first study is from the Journal of Human Hypertension in 2007, and I remember Dr. Timothy Johnson talking about this on television, and there were misalignments of the top bone and the neck. And so chiropractors did one chiropractic adjustment here. It reduces systolic by 14, diastolic by 8, and that was maintained for 8 weeks. One treatment reduced the blood pressure and is sustained for 8 weeks, as good as the typical 2-drug therapy for high blood pressure. That is pretty interesting. At the end, they talked about misalignments of the atlas can injure, impair, and compromise brainstem neural pathways. The second study on high blood pressure was out of the Asian Journal of Multidisciplinary Studies in 2015. Now, this was a study where they did thoracic adjustments, and it was only instrument. It wasn't manual stuff. It was an instrument adjustment one time, and there was improvement in systolic and diastolic blood pressure, improvement in pulse rate, reduction in there, and the blood pressure classification decreased significantly after one chiropractic adjustment, better than the sham. They gave some people a sham adjustment, and it was also better than the control group where they had no treatment whatsoever. I mean, that's pretty interesting. Here's a great study on thoracic adjusting on heart rate variability in women with fibromyalgia out of the journal Rehabilitation Research and Practice in 2014. 10 sessions of chiropractic produced a reduction in sympathetic activity. So that improved heart rate variability, which is a good thing, and reducing the debilitating signs and symptoms of fibromyalgia, improving quality of life, and reducing cardiovascular risk when applied for more than one session, 10 sessions there. Great study that talked about that in fibromyalgia. I've seen the same in my own clinical practice. The last little section here is going to talk about posture. Keeping in mind, one of the goals that we have is reducing this part of our posture, just terrible now with phones, computers, Corona jail, stuck at home with workstations and so forth. One of our goals is improving posture, improving curves. And a couple of studies here is if you have, out of the Journal of Manipulative and Physiologic Therapeutics in 2005, if you have a straight neck like this, you have an 18 times more chance of having chronic neck pain. Then this study here, if your head is 13 pounds, and if it goes forward 15, 30, 45, or 60 degrees, that is a relative, instead of 13 pounds of stress on your body, it's 27, 40, 49, or 60 pounds of relative pressure and irritation on the discs and joints and nerves on your neck. Imagine doing that for hours a day. And we know that high school kids are on their phones like this for 13 hours a day, say some studies. So that is a problem. I just want to mention Jean here. Jean is one of my patients, and she came in because she had chronic neck and arm pain after a whiplash injury. Now, she had it for 10 years. We worked her for 6 months and the pain was gone. So if you have chronic neck pains, even after an injury like that, you could benefit maybe from chiropractic care, as a lot of the other studies say. Here's a woman, Leanne, that comes in to me, reluctant to come in. Several people suggested her come in. She finally tried it. She had back and leg pain. I think she was only 30 years old at the time. We worked on her. Just in a few visits, she started getting relief, and she said, you know, I've got terrible allergies year-round, Dr. Fuller, and I take medications, and it's still terrible. Can you help? And I said, you know what? Try going no dairy products. She said, okay. So she did it, and they were gone, and she was totally psyched, right? So I just gave her one piece of advice, and that really helped. This is an interesting one to finish up on because, again, I'm talking about chiropractic care, brain, immune system, and this is Alternative Therapies in Health and Medicine 2011. That's the journal. Cerebral metabolic changes in men after chiropractic spinal adjusting for neck pain. So the patients had neck pain, and then they did PET scans, and they found a lower stress level and better quality of life in the treatment. Cervical muscle tone and salivary amylase were decreased after adjusting. The results of the study suggest that chiropractic adjusting affects regional cerebral glucose metabolism related to sympathetic relaxation and pain reduction. That's pretty cool. You work on the neck with chiropractic adjusting, you improve the blood flow to the brain. That's really important. My last patient is John, 20 years ago, chronic low back pain, was a musician, had to quit, comes in to see me, we start working on him. Here's why I tell you the story. He didn't stop care after a week. He didn't stop care after a month. The first year I saw him 3 times a week. The second year I saw him at least twice a week. 2 years, great testimonial he wrote from my website, and he said, hey, don't give up. After 18 months, I was a lot better, but not all the way better, and we pushed forward for 6 more months, and then finally my chronic low back pain is now gone, and that was 19 years ago, and he's doing really well, and he's super thankful, and so am I. Thanks for joining me. That is connections between chiropractic and the brain, and hopefully help with the immune system as well. I'm Dr. Scott Fuller.